Well, some Nebraskans who are using Medicaid are worried about the future of their health. Channel 8 Eyewitness News reporter Kelsey Murphy joins us now with more on the story. Kels?
Rod, the American Health Care Act passed through the House and is now being debated in the Senate. Some Nebraskans are urging our senators to fight Medicaid cuts. Others say federal cuts won't be a huge burden on Nebraskans.
I wasn't sure I was going to make it, but this last year, with the help of Medicaid, I've been able to get on prescription medications that I've needed. I've been able to go to physical therapy, see specialists.
Fear for a healthy future is on the minds of some Nebraskans. The most recent version of the American Health Care Act, passed by the House in May, would cut $880 billion from Medicaid. It's up for revision in the Senate right now, and some Nebraskans are worried how federal cuts will affect their health care.
Medicaid becomes the piggy bank that the state uses to fill in those other holes. So what they're doing is they're taking funding for health care for kids and seniors and people with disabilities, and they're just plugging holes in other parts of the budget.
Under the plan, Medicaid state and federal partnership would change to a per capita cap system. That system would give states a certain amount of federal money per enrollee. It's something a representative of the Nebraska GOP thinks our states can fiscally handle.
We would like to see the states administer it in a way that makes the most fiscal sense to each individual state. The needs for the disabled and elderly and pregnant population in California are going to be vastly different than needs here in Nebraska.
But members of Nebraska Appleseed say those funds won't keep up with healthcare costs.
It's very possible that whatever that amount is will be exceeded by what people actually need, and then the state has to make up the difference.
The GOP says it's premature to predict what cuts will be made.
The Senate's going to deliberate, and the Senate is going to make sure that the bill looks even better than what it did from when the House passed.
And there is no set timeline for when we can expect the Senate's revisions regarding the changes in the bill, but of course we'll keep you updated on how it will affect our state.
All right, Kelsey Murphy, thank you.